Amy. I'm a nurse midwife and more recently a nurse scientist. I used to work in a county health department in North Carolina where I got to provide care to some really amazing women. Let me give you some examples of what I did in this clinic. Breast exams, pelvic exams, pap smears, STI testing. I talked about sex and contraception all day long. And it used to piss me off when the patients would talk about the horrendous care that they had received from the provider that worked in the clinic before me. A few even mentioned that they had friends that wouldn't go back to the health department, one of the few places in town to receive free health care if you didn't have insurance, because of their interactions with her. Those stories stuck with me. Now, fast forward several years, and I find myself working ET, living in the foothills of the Smoky Mountains, researching reproductive health. As part of that research, Gretchen Ely at the College of Social Work shared a survey conducted with women living in Appalachia counties, and lo and behold, I see a cluster of questions about the experiences of healthcare providers. Midwife Amy and researcher Amy collide. Okay, but let's stop for a second. Do I need to state the obvious? Can we all agree that healthcare aims to help, not cause harm? Surely what happened with the bad provider in my old clinic was anecdotal. Don't physicians take a Hippocratic oath? Don't nurses take a Nightingale pledge? No one wants to be a bad provider. But to be blunt, sometimes the very providers tasked with providing care can be a source of mistreatment. Social interactions between a patient and provider that go poorly can be as bad as a misdiagnosis. Further, when mistreatment involves an element of labeling, stereotyping, loss of status, or discrimination, mistreatment can stigmatize a patient as well. So let's look at the data. Well, 2 out of every 3 survey participants reported a bad experience with a healthcare provider that made them not want to return. And 3 out of 10 participants reported a bad experience, specifically while seeking contraception, that made them not want to return. That's terrible. So what did people attribute as the reason that they were being mistreated? Almost a third mentioned either weight or income as a possible source of bias, while being Appalachian or being a woman was also noted. Now, those who reported bad healthcare experiences in general were more likely to be older, poorer, white, unmarried, and less religious. Perceived reasons for bad treatment while seeking contraception were similar, with just over a third reporting that it was either due to their weight or their income. Those who reported bad experiences specifically while seeking contraception were more likely to be poorer, less religious, and less likely to have ever had an abortion in the past. Next, people were asked about what their mistreatment looked like from an array of different pre-filled out survey responses. Commonly selected responses included the provider being rude or condescending, the provider not listening to the patient's concerns, and the patient not feeling comfortable with the provider. When it came specifically to contraception, over a quarter of survey participants reported that they had been pressured to use contraception by a healthcare provider, and almost 10% reported that they had felt pressure not to use contraception by a healthcare provider. Usually, when we think about contraceptive coercion, we think about it as coming from a sexual partner, but these findings suggest many sources. But the real meat of the topic was found in the open-ended responses from the participants. Many reported that the religious beliefs of their provider influenced the education they received, the choices they were given, and made them feel judged. One woman said, quote, "The provider pushed abstinence and God instead of giving me my options." The poor health infrastructure in Appalachia, from having too few providers to long wait times, meant that people didn't feel like their healthcare concerns were given sufficient respect or time. One woman said, quote, "Quality is low. You can get healthcare, but they don't care about you or fixing your problems." And of course, the title quote about healthcare, "It's far and it sucks. They don't listen to you." The influence of patriarchal norms and expectations also manifested in providers giving judgmental or inaccurate information to patients, especially regarding reproductive health. One participant said, quote, "I have an IUD and was told by the doctor that it caused spontaneous abortions." It doesn't. And that I can't have a tubal ligation until I'm 30, and then only with my husband's consent. The fallout from the opioid crisis also impacted how patients viewed providers and how providers viewed patients. One woman said, "I have to lie about previous drug use in my prenatal visits because I have struggled with fertility and miscarriages, and to get a doctor to focus on my body instead of my drug use, I have to lie to get good quality care." Finally, the role of poverty in limiting access and creating narratives about worthiness also influence healthcare interactions. One woman said, quote, For women to get birth control, they would have to feel like they have control over their welfare, meaning not doomed to be poor forever, regardless of the choices they make. The problem is poverty, end quote. So how does this affect people seeking care? Women seeking care reported being called unicorns if they were virgin, being called loose or slut-shamed if they were sexually active. Countless stories revealed people's concerns being dismissed or ignored, like the woman who was told to lose weight by her healthcare provider instead of actually being listened to and having her concerns addressed. And why does it matter? Well, before we label all providers as monsters, we should consider that data suggests that provider burnout and patient mistreatment are two sides of the same coin. And how have the last 2 years been? Since this data was collected prior to the pandemic, there's a reasonable chance that patient mistreatment and discrimination have increased as provider burnout has increased. What is essential is that healthcare providers have a responsibility to serve as gatekeepers to much of what healthcare has to offer. Health knowledge, medications, testing, a trusted ear. When mistreatment and stigmatization occur, the provider effectively closes the gate to the patient, severing them from care. This closed gate means that people lose access to things like prescriptions for birth control, access to prenatal care, STI testing. We are so quick to blame individuals for things like teen pregnancy or having too many children, but we do a horrible job exploring the root causes of these outcomes like mistreatment and stigma. The biggest take-home message is not that providers themselves are terrible people, though that was sometimes the case. Rather, provider treatment is a lens from which to view social narratives about health, reproduction, and worthiness. People seen socially as unworthy will eventually be treated as such. So celebrating the inherent worth of all people is a critical first step to improving health outcomes.